If you've been thinking about finding a therapist, maybe you've been looking through some directories and you saw a whole bunch of letters after the therapist's name, and you wondered, what do those letters mean? Well, I'm going to tell you a little bit more about the credentials that you might be looking for as you think about going into therapy. So some credentials indicate that the person can prescribe. Now, I'm talking about the state of Illinois, where I am licensed to work. So in Illinois, prescribers generally are going to be medical doctors, so they have the MD after their name, or a doctor of osteopathy, so that's going to be a DO after the name, or the person might be like an APRN, an advanced practice nurse. Those people are all licensed by the state to prescribe in the state of Illinois. And generally speaking, that's what they do. They, generally speaking, do not provide talk therapy. So if you're looking for talk therapy, you probably are not going to go to one of those people, although there are some exceptions. In general, if you're looking for talk therapy, you're going to go to one of 4 different types of licenses here in the state of Illinois. You will seek out either a licensed clinical professional counselor, an LCPC, a licensed marriage and family therapist, an LMFT, a licensed clinical social worker, an LCSW, or a licensed psychologist, an LP. Often the licensed psychologists don't use the LP. They typically use either their PhD behind their name or PsyD, P-S-Y, capital D. And I'll tell you a little bit more about that in a moment. But let me go back to the top of that list. The licensed clinical professional counselors are master's level psychologists. So they have they've met specific education and training requirements and supervision requirements to be ordered to use that credential, the LCPC. They can provide psychotherapy services independently, as do all 4 of those types of licenses that I just mentioned. Generally, for an LCPC, the individual has to have a master's or a doctoral degree in counseling or a related field, and they have to complete a specific number of supervised clinical hours. Typically, it's 3,000 hours. There's some variation in how many of those are in direct client contact and how many are in doing other tasks. They've had to successfully pass the National Counselor Examination, the NCE, or a similar state-approved exam. Now, you might find someone that has an LPC behind their name. Now, in Illinois, that means they're a licensed professional counselor. They are sort of the junior level of behind an LCPC. They are, it's considered a provisional license. In other words, that person with the LPC is working under the supervision of a fully clinically licensed person. So they are gaining hours out in the field to be able to sit for their clinical licensure exam, the one that allows them to have 4 letters and to practice independently. Now, what's a little confusing about the LPC, in Illinois, that's a provisional license. Again, that one under supervision. But in most other states in the country, the LPC is the same thing as Illinois' LCPC. It's confusing, isn't it? So you can always ask the therapist exactly what their license means. And are they licensed to practice independently? Because if so, that means they have more experience and are probably a little bit more, shall I say, advanced in their field. The second one that I mentioned was an LMFT. So that's a licensed marriage and family therapist. So that's a professional license specializing in marriage and family therapy. So they've completed supervised hours. Typically, again, it's 3,000 hours. And they've successfully passed the marital and family therapy examination or a state-approved license that's similar to that.